In this playlist of orthopedic rehabilitation protocol, we are starting a knee joint. The knee joint second pathology is the meniscus tear. Knee has two meniscus, that is the medial and the lateral. Medial meniscus is the largest. In the meniscus tear, conservative management is sometimes enough to relieve the pain of a torn meniscus. Conservative treatment is mostly recommended in case of meniscus tear. And sometimes in other cases we also go for surgical repair. The symptoms of the meniscus tear are a popping sensation, swelling or a stiffness in the muscles, pain, especially when twisting or rotating the knee joint, difficulty flexing or extending the knee fully, full movement, full range of motion, feel patient pain in the meniscus tear, locking sensation, feeling of the knee giving away. These are the sensations that the patient complain of: swelling, stiffness, pain, and the difficulty in the movement and the locking sensations. Next, there are some special tests to diagnose the meniscus tear. The first test we do is the McMurray test. In this test, patient lying supine plus knee in the full flexion. For the lateral meniscus, to check the lateral meniscus, rotate the tibia medially, then extend the knee. For the medial meniscus, rotate the tibia laterally and extend the knee. Repeat these two tests for the several times, these two positions for the several times. If there is the clicking sound or the pain, then it is this positive meniscus tear. McMurray test is positive. And always compare with the unaffected or non-affected side. The second test we do, this is the position for the McMurray test. The second test we do is the Apley test. In the Apley test, patient lying prone plus 90-degree knee flexion, traction or the pulling apart of the tibia plus lateral and the medial rotation. And in the second position, we do compression on the tibia and the medial and the lateral rotation. When the patient feel pain, any kind of painful sensation, then this is the positive Apley test, and this painful sensation is in the compression. These are the two tests, McMurray test and the Apley test. If traction, so excessive motion, when the physiotherapist do traction and the patient joint motion is excessive or pain, then this is the ligamentous injury. If the compression, then there in compression, when there is pain, then this is meniscus tear. And in case of traction, the patient feel pain or excessive motion, then this is ligamentous tear. Anterior cruciate or the posterior cruciate, these two are the knee ligaments. And always compare the test with the unaffected or non-affected side. Meniscus tear rehabilitation. First, we have phase 1. This is the immediate post-operative phase. It's of 0 to 2 weeks. The goal in this phase is to protect the repair side, reduce patient pain and swelling, restore the patellar mobility, restore full extension, and minimize muscle inhibition. We do muscular exercises, muscles range of motion, joint range of motion, so that the muscle is in the working position to minimize the muscle inhibition. Re-establish quad control. Patient education in the acute phase is very important. Keep the knee straight and elevate when sitting or laying. Don't rest with a towel placed under the knee. Don't place towel under the knee. Do not actively bend the knee. Don't overload the joint in the acute phase. Okay. Don't pivot on the surgical side. So these are the precautions. We do patient education, and goals is to protect the repair side, reduce pain, swelling, and restore patellar mobility. Weight bearing. For weight bearing, we do walking, brace locking, crutches, partial weight bearing, or according to the protocol, according to patient condition. We go for partial weight bearing, leading with the non-effective side when going up the stairs. Remember this, leading with the crutches and surgical side when going downstairs. And intervention we do is the in the acute phase we go for swelling management. For the swelling management we do icing, compression, elevation, retrograde massage, ankle pumps for the improving blood circulation, and range of motion mobility exercises, patellar mobilization, superior, inferior, medial, and the lateral, assisted knee flexion, extension, heel slides also recommended in the phase 1. Low intensity, if there is low intensity then the duration will be longer. Supine passive hamstring stretches also recommended. Strengthening exercises, quadriceps, neuromuscular electrical stimulation of the high intensity supine knee extension with the contraction 10 contractions 2 weeks during sessions, 2 week per 2x per 2 times per week. In the acute phase we don't go for aggressiveness. Straight leg raise, don't perform straight leg raise if the knee extension lag. Confirm this condition with the physician. The strengthening exercises, don't go for progression. In the phase 2, that is intermediate phase, it's of 3 to 5 weeks. The goal in this phase is to continue protect the repairing side, minimize the patient pain and swelling, maintain full extension, and the flexion is less than 120 degree. Don't go for full flexion range. Weight bearing we do is the walking, continue partial weight bearing. Consult with the physician regarding unlocking brace. If the patient want to remove the brace, then always consult with the physician. The intervention we do that we discussed previously is the range of motion, mobility, static bicycle. This is for the muscle strengthening. Cardio exercises, upper body ergometer. Upper body ergometer is also very important for the blood circulation. Strengthening exercises, calf raise, lumbopelvic strengthening, side laying, hip external rotation, and for the balance and the proprioception joint position. These exercises, strengthening exercises, is play a vital role. Double limb standing balance, utilizing uneven surfaces, wobble boards, joint position, retraining, hip abduction position. These are all for the strengthening in the phase 2. In the phase 3, that is the late post-operative phase, this is of 6 to 8 weeks. The goal in this phase is to protect the repairing side, avoid patient pain and swelling. If there is pain and swelling continuously and don't subside, then remove or discontinue the patient treatment. Maintain full extension and flexion within 10 degree of contralateral side. Flexion range need to be precaution. Safely progressive strengthening, promote movement patterns and normalize the patient gait, patient walking pattern. Weight bearing in this condition is the can discontinue use of brace according to the patient condition after the 6 weeks, and once adequate quads control is achieved, do for quadriceps control. Quadriceps are knee extensors. Intervention we do is the range of motion, mobility, supine active hamstring stretches, standing gastrocnemius stretch, and the soleus. Soleus is the deep muscle, and the gastrocnemius is the superficial muscle of the back of the leg. So go for gastrocnemius and soleus stretch. Soleus is also known as peripheral heart. Gentle stretching of all the muscles, quad stretch, prone quad stretch, standing quad stretch, knee, hip flexor stretch, all the lower limb stretches can be recommended. Cardio exercises, bicycle, stationary bicycle, and for the strengthening exercises squat, partial squats, mini squats, hamstring strengthening, prone hamstring curls, these all are recommended. Lumbopelvic strengthening is we discussed this before, this is also recommended in this condition. Gym equipments, leg rest machine, hip abduction, adduction machine, hip extension, all the lower limb strengthening exercises is recommended. Balance or proprioception for the patient. Single leg balance, progress to the uneven surface included perturbation training. This is on the balance board. This is also recommended for the patient proper balance and proprioception. In the meniscus tear rehabilitation, this is our fourth phase. Third phase we can complete. This is we study strengthening, stretching, and the balance exercises. And in the phase 4, the goal is to maintain and full range of motion, safely progress, strengthening exercises, movement pattern properly doing, avoid post exercise pain and swelling. If there is pain and swelling, then you can discontinue. Avoid patient pain and swelling during the exercises and after. Intervention we do is the same that we discussed previously: cardio, stair climbers, strengthening exercises, squats to the chair, lateral lunges, single leg progression. These are all the single leg squats, wall squats, these all these step ups with the march. These all are the strengthening exercises of the lower extremity. In the phase 5, this is for the athletes, and in this phase we have to return the patient to the sports activities. This is of 3 to 5 months. Its duration is of 3 to 5 months. The goal is to progress strengthening, specific sports training, proper movement patterns, and always remember avoid post exercise pain and swelling. Intervention we do is through running program, return to the running program, polymetrics means exercises in the many planes, and agility program means direction within a seconds changing. Okay, the sports activities that require agility, and polymetric we go for specific these type of activities for the patient to return to the sports. And in the phase 6, it is unrestricted return to the sports. It is of 6 plus months. The goal in this phase is to continue proprioceptive and strengthening exercises, symmetrical performance with sports specific drills, and the patient is now able to fully progress to the sport activities. The intervention we do is the multiplane, in means in the many planes, sport specific polymetric program, and in the agility program include hard cutting and pivoting depending on the patient goals. We have focus on the polymetrics and the agility programs. Non-content practice full and return to the full sport, and patient return to this full sports activities is always concerned with the sports physiotherapist. We discussed today is the meniscus tear and the special test to diagnose the meniscus tear, and we go for detailed description of the rehabilitation of the all the phases of the meniscus tear. Then this is the question test for the meniscus tear, or write the names of the test in the comments. Thank you.